Welcome to fyh.news News podcast. Excited to have you all here. We have the first in the building, first AVP of Health Equity at Merck, Miss Etiebet. Thank you so much for being here.
Thank you for having me.
And we are at the Cancer Care Summit, and we have had a great time talking about why it's important to increase quality healthcare in underserved communities. And I would love to learn more about why it was important for Merck to be represented in this conversation today.
Well, thank you so much, Queen Star, for inviting me. I think just to specifically answer your question, we felt that it's important to be part of this conversation because it's part of our mission, to save and improve lives across the world. And we are so excited when we're able to bring the power of our innovations and science to save and improve lives. One of the things we ask ourselves in the company, and we've been asking this, for decades, is how many people are we helping and how much are we helping them? Mm-hmm. But one of the things that teams across the company are asking now is, who are we helping?
Important questions.
Very important question. Because if we don't ask that question, we're reinforcing the inequities that exist in the societies that we're working in. And that should not be the case, because there's so much we can do to actually dismantle, some of those inequities and to think through, how do we reach people that have not historically been reached? How do we reach people that have remain underserved? And so to be able to share with the broader community some of the lessons that we've learned, through decades of partnerships, some of the insights, some of the things that work, and also things that don't work. And to share as well what we're hearing from the communities that we're working with. Because at the end of the day, this is about how do we serve them, and it's about what they want us to do. So I'm just really excited to be here and sharing some of that.
No, and I think it's very important to ask those questions, because I think historically, folks have, maybe if you did not look like those types of communities, you wouldn't think to ask that question. Are they part of this discussion? Yeah. Are they represented in what we're creating here? And what I loved when reading your bio, because I like to do some research, especially if it's going to be an African women powerhouse conversation. You got to do your research. Yeah. Your work is specifically focused on maternal health, with really affects the Black community and minority communities, underserved communities. Tell us a little bit about that work and why it's important to you.
No, I'd love to, and and just to take a step back, I was so excited, to be able to join Merck, which is also known as MSD outside the U.S. and Canada, to help lead their Merck for Mothers program, which was created back in 2011. We know now, and that's because of the investment in research, that Black women in the U.S. are 2 to 3 times more likely to die from preventable complications during pregnancy and childbirth.
It's a developed nation. Let's be very real.
One of the, if not the richest nations.
This is an abomination. It should not be happening.
The other thing that's happening is that number has actually gotten worse, not better, in the last 25 years. You talked about us being African women, and the fact that on the continent, the rates, of maternal death are atrocious, I think in some countries, you, as a woman, as a girl growing up, you have a 1 in 50 chance of actually dying during childbirth. But in our family, that's immigrated into this country, my sister-in-law, about 28 years ago, unfortunately died, during childbirth. She walked into a hospital, didn't walk out. And her daughter today has a higher chance of dying during childbirth than her own mother. And so when you think about that dynamic,
it's generational.
It's something that we need to reverse the trend. We have to do more here. And I'm glad you brought it up, because it brings up the issue of wherever we're working in the health space, there are so many different connections to make. When we are partnering through the Merck for Mothers initiative, to improve maternal health, we should not be abandoning women after they've given birth. How do we now set them up to thrive across a lifetime? And issues like cancer prevention, how do we share that information, with women? How do we think about cancer prevention? There are vaccines that can help prevent, cancers that are killing people around the world. And so the other thing that's also exciting about that work is, again, how do we learn from it and apply those learnings into other areas of health? So just excited to share all of that.
Yeah. And how are you spreading that information to women? Talk about some of the initiatives that your team is working on.
So a number, here in the US, we're actually really excited about a partnership we have with the CDC and the CDC Foundation. It's called the Hear Her campaign. And it is specifically in response to stories that we heard where Black women specifically were not being listened to when they shared their signs or symptoms of complications or their worries during the process. And so we created, or CDC Foundation created a campaign where it's about lifting and elevating and amplifying voices of women and them sharing their experiences. And what we found is that almost gives permission, for other people to also share their experiences. But the really important thing about that campaign is that while we need to increase awareness of these stories, the burden really needs to be on the healthcare system and
Absolutely.
the healthcare provider to respond and to respond appropriately, to respond in a timely manner, to make sure that they're addressing, those issues and saving lives.
Yeah, that's so important. I just thought about a friend who passed away in 2019 in childbirth, and it's because she wasn't listened to.
As simple as that. And that not listening is because people don't value Black women. Because if you value the life sitting in front of you and you're an active partner and you think of your patient as an active and equal partner in your healthcare, you're going to listen to her.
It's real. And I think it's important to recognize that this issue is not just concentrated in Black neighborhoods. We are seeing the data specifically for Black women, but there are women across the world that are not being heard when it comes to maternal care. So I'm so thankful that Merck is taking this challenge on, and thankful that you're leading the helm to make this happen.
I'm no longer leading the initiative, but I will definitely let the team know. Because they are just doing such amazing work and such amazing work to spread, again, all of those partnerships that are happening.
Yeah, awesome. Well, thank you so much for making the time. I know New York is your home base, so enjoy Brooklyn for all of us who can't be in Brooklyn every single day. And thank you for your work at Merck.
Thank you so much.
Thank you.